we're back. I always like to talk, wait till the music stops. So here is a little bit. All right, that was a good set. Listen, these apples here, don't be using them as a weapon when we get into that final segment today.
I'll use rocks.
Yeah, pretty sure.
By the way, I can juggle. So if you're
Can you do that?
If you're very lucky, I can show you some juggling.
Wow. And
How many?
3, not 4.
I can juggle 2.
Really?
Is that juggling?
I can juggle 1. Okay, moving on to our next segment. Ryan was good enough to bring our cardiologist, and you had a show. What was the name of the show you had?
I had the Sunday morning medical hour, and
Okay.
it was every Sunday at 11 o'clock for almost 21 years.
Wow.
Here, and it was always in the
It
afternoon?
was on this station for the last year, for 2012. But prior to that, on WDJA, which emanated from Delray on Atlantic Avenue.
On Atlantic.
Yes.
Also, I remember when I came in here one afternoon, were you doing cardiologist stuff? Were you talking about the heart and stuff
Yes.
in the afternoon?
The show was
Medications?
all about medicine. People would call in, ask questions on the air live, and I would try to answer them.
I remember it was not too long ago that I came down here and I saw you in the afternoon. And I'm looking through the glass. I'm saying, hey, I know this guy really, really well. Delray Medical Center,
Mm-hmm.
cardiologist.
Yes.
How long have you been there?
I've been on staff since 1991, so 21 years.
Wow,
Long time.
long time.
Almost embarrassed to say that.
No, not at all. And you've seen a lot of change in the last 21 years in
Yes,
this
change
field.
in Delray Medical Center and also change in cardiology for sure.
And that's one of the things I wanted to ask you. What kind of changes have you seen that have really significantly, because I know it starts out slow and then it's moved up rapidly in the last...
Right, well, I can tell you that from when I was in medical school and my internship, that was the mid-'80s, the treatment of acute heart attacks was a very medical type of thing. In other words, there was no intervention, no surgical or percutaneous through the skin angiography and that type of intervention to open an artery directly. But starting in 1985, people began to do angioplasty, balloon angioplasty,
Right.
and then in 1994, stents were created and brought to market. So the science of actually physically intervening and reopening a blocked artery came to be, and that was a dramatic improvement. That changed everything. So now the treatment of an acute heart attack is not just giving medication, but taking the patient immediately to the cath lab and getting in there and reopening an artery.
I also saw where they are doing a lot of stuff with valves now, where they put
Yes.
some kind of through the
Yes.
artery and they sort of expand the valve and then
Yes.
change it.
Well, that technique is primarily with the aortic valve. There are 4 valves, and of course they're all important. The last valve in the heart before the blood leaves the heart is called the aortic valve. And there's a common condition called aortic valve stenosis, or hardening, or calcification of the valve, where the valve stops opening normally. It was much more common in the era when rheumatic fever occurred all the time in young people, and the rheumatic fever tended to damage the heart valves. But even now, we see a lot of older people with severe calcification of the valve, and very often, once a person reaches mid to late 80s, real surgery to open the person up and put a new valve in becomes increasingly difficult because of other medical problems, comorbidities we call it.
Mm-hmm.
So a technique was developed where a real valve, a cow valve, is scrunched down into a small cylinder over a wire, over a balloon, and it's then introduced through the groin into the femoral artery, snaked all the way up to where the bad valve is. The new valve is then put through the bad valve, and then when the balloon is blown up, literally expanded, the new cow valve is forced open and deployed, and it literally crushes the old valve against the walls of the aorta. And when the balloon and the wire are taken away, the new valve is there and takes over.
Yeah, I saw that. It was amazing.
Mm-hmm.
Speaking with Dr. Bruce Martin from Delray Medical Center. medicines. One of the when I was doing some research for this part, a lot of people wanted me to ask you. There's a lot of conflict right now as to medicines for the heart. Some are deemed not effective, but just a ploy by the pharmaceuticals to sell medicines, and others are actually doing good stuff. So one of the people that that I was talking to this afternoon and they're listening tonight wanted to know what's going on in that field right now. What's the best stuff out there?
Well, you know, that's a very interesting topic, because the way you asked me the question, that people think that it's a ploy that certain medications are not effective, it's actually just the reverse.
Okay.
The statin medications, the most common ones, the first one was Mevacor, then Zocor came about, and then Lipitor, then Crestor. Those medications that came to market in 1985 have been probably the most dramatic medical development in the entire history of cardiology. They've had the biggest impact. Now, of course, they don't stop the process of hardening of the arteries completely, but they have dramatically changed a person's risk factor profile. Now, along with that, of course, comes the alternative medical field, which is really not a medical field per se. The alternative people are really fakers. I hate to say the word fakers.
Like the red yeast rice theory
Well,
and all
red
that?
yeast rice is actually a statin. That's something that people don't realize. Red yeast rice is actually Mevacor.
Really?
Yeah, it's the raw form of Mevacor.
Okay.
The alternative people in the health food stores make believe that it's not a statin, and they say it's just a natural product. It is a natural product. It's the natural form of Mevacor. But it's a much lower dose. It's only 1 or 2 milligrams, whereas we would tend to use, let's say, 20 or 40 milligrams of Mevacor to treat a patient.
What about to prevent heart issues? Would you recommend that the average person take red yeast rice from GNC, let's say?
No, because it's such a low dose, it doesn't really have the impact that we need. When we want to lower cholesterol, we first of all look at the LDL and the HDL. The LDL cholesterol is the bad one, and that's the one that we need to get all the way down, preferably below 100 and perhaps even as low as 70 or below. To get that down in a person with an LDL of, let's say, 150, red yeast rice just doesn't have the power to do that. We need a much higher dose. Of course, you could take 10 red yeast rice tablets.
Right.
That might do it. But in order to get it down to where we need it to get down to have a real pharmacological effect, we need to get a dose of at least 20 or 40 milligrams. And that comes with the real the pharmacological agent of Mevacor or Zocor or Lipitor or Crestor.
I've heard that people with higher LDLs, that the number 100 is something like what Freddie said that the pharmaceutical companies have come up with. What is the truth on that?
There have been many, many studies that looked at that starting in the 1980s, and almost all of them prove to any medical certainty that the statins are very effective, and getting the LDL below 100 dramatically lowers your risk of a heart attack or a stroke. There was one major study called the 4S study. It involved Zocor. The reason it's called S is because the generic name is Simvastatin. It's the Simvastatin, Scandinavian Simvastatin Survival Study. That's the 4 S's. And that looked at Zocor 40 milligrams versus placebo. And it showed a dramatic difference in a person's risk of a heart attack or a stroke. So at that point, statins were more or less proven to work. And then all the subsequent studies have shown the same thing. So it's very consistent and uniform in the research.
Now, do those statins clean out the arteries of the plaque and things of that nature? Because I know they have me on the statin.
Yes.
But it also has side effects of,
It does.
It hurts your joints are like.
Right. A lot
Oh
of
my
people
goodness.
complain of that. In fact, I do it myself. I feel the same thing. Unfortunately, a lot of people feel musculoskeletal aches and pains, and it can also affect the liver. But most people can tolerate it quite well. In fact, there have been studies. For example, there's one study called the West of Scotland study that looked at Pravachol, Pravastatin. Over 6,000 men, not a single patient had to stop the medication during the study because of any side effects whatsoever. So we're talking about medications that are very well tolerated in general. although some people do have side effects.
Why are men more prone to heart disease than women?
Well, it's a very interesting question, and that leads us directly into the discussion of Go Red for women. Men are more prone to it for a couple of reasons. First of all, it seems that estrogen has a protective effect.
Mm-hmm.
So, of course, a younger woman with high estrogen levels seems somehow protected for perhaps 10 or 15 years.
Right.
But once a woman goes through menopause, her risk then equals a man's. And what happened was, in the 50s and 60s, first of all, everybody was smoking. After the war, after World War II, everybody smoked in the country, especially men. And so in the 60s, there was suddenly literally an epidemic, an explosion of heart disease in men, because all the men were smoking. They were all veterans now, and they all smoked.
Mm-hmm.
So there was actually a false impression that heart disease was primarily a disease of men. As a result, many of those studies done in the 60s and 70s were done primarily on men. But then in the 80s and 90s, people started to realize, wait a minute, women are having a lot of heart attacks also. And when we looked further into it, we found that women have a very high rate of heart attacks. In fact, 1 out of 3 women will die of heart disease.
Really?
Mm-hmm.
Which is a lot. It's way more than cancer.
Yes.
Way more.
Number 1 killer, I heard.
Right. There's no comparison. It's way more than all causes of cancer. So perhaps in the last 15 years or so, people came to the realization that women are just as much at risk. And therefore, there's been this new focus on making sure that women are educated, because there's a tendency to poo-poo, if you don't mind the expression, poo-poo the symptoms in a woman. For example, if a woman has chest pain or shortness of breath or sweating or nausea, a doctor or a person might be more prone to thinking, well, it must be acid reflux, it might be in her mind, it might be something else, without realizing, wait a minute, this really could be a heart problem. So there's now this new focus to try to make sure that everybody realizes that when a woman presents with symptoms, to take her very seriously, just as much as a man.
Mm-hmm.
Yeah, I think women are under the impression that it's not going to happen to them, that it's a man's issue.
Right, it's true. Because the onset of heart disease in women tends to be a little bit delayed, perhaps by 10 or 15 years, the peak of its onset compared to men. Men in their 50s and 60s begin to have heart problems, heart attacks, whereas women in their 60s and 70s begin.
You mentioned estrogen as a protection. What role does testosterone or decreasing testosterone have on a man?
Well, it's a good question. Unfortunately, testosterone seems to be a risk factor. But here's the ironic thing about estrogen. It seems that estrogen in young women is protective, but if you take estrogen after menopause, it becomes a risk factor. And nobody really knows why that is. That's still being looked at.
See, my mother is still taking hormones for menopause, and her doctor feels that it's safe, and she's gone for second and third opinions. As soon as she goes off the hormones, she starts with the hot flashes again.
Right. We use estrogen in women if they're suffering from the symptoms of menopause. But unfortunately, the studies do show that it does increase the risk of a heart attack or a blood clot a little bit. So we as doctors, we're faced with a little bit of a dilemma. We're faced with a woman who's having a lot of symptoms of hot flashes and just feeling miserable, and we have to balance that versus the small increased risk of a heart problem. Now, if a woman has a very strong family history of heart disease, that might actually dissuade us from giving estrogen.
Mm-hmm.
But if a woman has no family history of heart disease, we may say, well, all right, let's take the risk and help her with her symptoms and understand that there is that slight increased risk of a heart problem.
It's usually the gynecologists who prescribe the estrogen, though. Are they really qualified, or should a cardiologist be doing it?
Well, we hope that they're qualified and they know about what's going on in the literature. I think they are mostly.
Well,
Yes.
it should be sent to a cardiologist if they're going to go in that direction.
Yes.
It makes more sense.
But it's very easy to ask a person what his family history is. Just ask, how old were your parents when they died? And what did they die of? If the person says, well, my father died of a heart attack when he was 65, you might have extra double thoughts about starting estrogen.
Mm-hmm.
What were you going to say about the testosterone?
Testosterone seems to be a risk factor for heart disease, and especially in people who take testosterone or many of the other androgenic hormones for bodybuilding or whatever. That does seem to be a risk factor for hardening of the arteries.
Interesting.
So what are men supposed to do if their testosterone decreases as they age and they have low energy? What do you think should be done?
Well, mostly we don't treat it. Mostly we treat in other ways. Perhaps there's one thing that goes on in a lot of older people, especially men, that affects their energy level, and that's the possibility of having sleep apnea. And that's a very common thing. We are finding that it's much more common than we thought. And it turns out that a lot of times men, and women by the way, complain about having a lack of energy or feeling sleepy during the day. It's really the result of poor sleep or sleep apnea rather than a low testosterone level.
Well, there you have it.
Interesting.
Okay, Dr. Martin, Delray Medical.
Yes.
Do you watch? Do you take patients separately? Or
Oh, sure.
Okay, so why don't you give us a plug-in?
Okay,
How
sure.
to
My
get that?
office is right on the corner of Linton and Military, right near the hospital. The phone number is 561-499-9990. And we'd be happy to see new patients.
Any websites?
The website is www.cardiologydocs.com. That's DOCS, short for doctors.
Okay.
So Cardiology Docs. And by the way, we're also doing a screening program for young athletes. I'm sure you've heard about these young teenage athletes who suddenly drop dead of a cardiac arrest when they're playing sports.
Yeah, that's very scary.
Yes, we started a screening program to look for those kids. And the screening website is www.cardiacscreeningcenter.com. So you can go check out that
Excellent.
website.
That's good to know. I used to coach high school. My son
Well,
who's out there. He
yeah.
has a state championship from Florida.
And bring them in for screening.
Absolutely. Why not? Okay. Thank you very much for coming on.
Thank
Okay,
you.
thank you.